For decades, seniors have been told the same thing: protect your bones by taking calcium. Calcium has become almost synonymous with aging well. It is recommended in commercials, written on supplement bottles, and mentioned at nearly every doctor's visit. But what if calcium is not the most important mineral after 60? What if there is another mineral that quietly plays a bigger role in muscle strength, heart rhythm, nerve function, sleep quality, and even bone health? Yet most seniors are not getting enough of it. The truth is, focusing only on calcium may not be enough. In fact, without this other mineral, calcium cannot work properly in your body. And when levels drop, the symptoms often look like normal aging: muscle cramps, fatigue, irregular heartbeat, weakness, poor sleep, balance problems. Many people never suspect a mineral imbalance. In this video, we are going to talk about the mineral that becomes critically important after 60, why deficiency is so common in older adults, the warning signs most people ignore, and what you can do to protect your strength and independence. Because aging well is not just about stronger bones. It is about stronger muscles, steadier nerves, and a healthier heart. And while calcium is important, there is something most people are not told clearly enough. After 60, another mineral often becomes even more critical. And that mineral is magnesium. Magnesium does not get the same attention as calcium. It is not advertised as heavily. It is not discussed as often. But it plays a role in more than 300 processes in your body. And here is what surprises many people. Without enough magnesium, calcium cannot function properly. Why magnesium matters so much after 60. As we age, magnesium levels naturally decline. Absorption becomes less efficient. Diets often lack magnesium-rich foods. Certain medications, especially diuretics and acid-reducing drugs, can lower magnesium levels even further. At the same time, the body becomes more sensitive to imbalances. Magnesium is essential for muscle contraction and relaxation, heart rhythm stability, nerve signaling, blood sugar control, bone strength, sleep regulation. If calcium tightens muscles, magnesium helps them relax. If calcium helps bones stay strong, magnesium helps regulate how calcium is used and deposited. When magnesium levels drop, calcium can accumulate where it should not, potentially contributing to stiffness in blood vessels and muscle tension. Balance between the two minerals is what truly matters. Symptoms: many seniors overlook magnesium deficiency often develops gradually. It may show up as muscle cramps or twitching, increased fatigue, trouble sleeping, anxiety or irritability, irregular heartbeat, weakness, headaches, worsening blood sugar control. Because these symptoms are common in older adults, they are often blamed on aging. But sometimes the body is signaling a mineral imbalance. And here is the key point. You can take all the calcium you want, but if magnesium is low, your body may not be using that calcium effectively. Magnesium and bone health. Many people assume calcium alone builds bone. In reality, magnesium plays a critical role in bone structure and in activating vitamin D, which helps calcium absorption. Studies have shown that low magnesium levels are associated with reduced bone density and higher fracture risk. So when we talk about protecting bones after 60, magnesium deserves equal attention. Modern diets often contain less magnesium than they once did because soil mineral content has declined and processed foods dominate many meals. Additionally, stress increases magnesium demand. Certain medications commonly prescribed to seniors, including diuretics and proton pump inhibitors, may also reduce magnesium levels over time. And since routine blood tests do not always reflect total body magnesium accurately, mild deficiencies can go unnoticed. What you can do. First, do not stop any prescribed medications without medical guidance. Instead, consider discussing magnesium with your healthcare provider, especially if you are experiencing symptoms like cramps, fatigue, or sleep issues. Magnesium-rich foods include leafy greens, nuts and seeds, legumes, whole grains. Some people may benefit from supplementation, but the form and dosage matter. Magnesium glycinate and magnesium citrate are commonly used forms, but individual needs vary. The goal is not to replace calcium. The goal is to balance it. Aging well is not about focusing on one nutrient in isolation. It is about understanding how nutrients work together. Calcium is important, vitamin D is important, but magnesium is often the quiet partner that keeps the system functioning smoothly. After 60, muscle strength, heart stability, sleep quality, and bone health all depend on proper mineral balance. If you have been focused only on calcium, it may be time to look at the bigger picture, because sometimes the most important nutrient is the one no one talks about. Growing older does not mean becoming weaker. With awareness and proactive choices, you can support your body's natural systems. Magnesium may not get the spotlight, but it plays a powerful role in helping you stay steady, strong, and resilient. If this information was helpful, share it with someone who is focused on bone health after 60. Sometimes small adjustments make a meaningful difference.